Tonight, you will lie down, close your eyes, and stay in one position for 7 or 8 hours straight. Your full body weight pressing into the mattress, gravity pulling on your organs, your airway narrowing or widening, depending on which direction you happen to face, your spine bending or straightening, your stomach acid, sitting still or creeping upward toward your throat, all of it determined by one thing you probably picked when you were a kid and never questioned since. Most people treat sleep position like a personality trait. You are a back sleeper or a side sleeper, the same way you are left-handed or right-handed, just a quirk. But your body does not see it that way. Your body sees 8 hours of sustained mechanical load. It sees gravity rerouting fluid through your brain. It sees an airway geometry that either stays open or partially collapses. It sees acid either pooling safely in your stomach or washing against a valve that was never designed to hold it back in that orientation. Sleep position is not preference, it is architecture under pressure. And the difference between the best and worst position is not comfort. It is what happens to your airway, your spine, your digestion, and even your brain's ability to flush out waste while you are unconscious. Today, we are ranking the major sleep positions from worst to best, based on what they actually do to your body. Not opinion, not trend, pure anatomy and gravity. Position by position, you're going to see exactly what each one does to your airway diameter, your spinal alignment, your acid reflux risk, and a waste clearance system in your brain that most people have never heard of. By the end, you will know precisely where your position falls in the ranking and what one adjustment tonight could change. We are starting at the bottom, stomach sleeping, the bottom of the ranking, and it is not close. When you lie face down, you cannot breathe into your mattress, so your head turns to one side. Simple enough. But think about what that actually means for your neck. Your cervical spine rotates 70 to 80 degrees, close to its maximum range, and then stays there. Not for a second, not for a stretch, for 7 or 8 hours. Your neck joints, the tiny facet joints that guide each vertebra, are pinned under sustained rotational stress all night long. The muscles on one side are stretched, the muscles on the other side are compressed, and the nerves that exit your upper spine, the ones that feed sensation to your scalp, your jaw, the back of your head, are being loaded the entire time. That stiff neck you wake up with is not because you slept wrong for a moment. It is because you held a near end range position for the length of a full work shift, but the neck is only the start. Face down, your lower back sags into the mattress. Without anything supporting your hips, your lumbar spine drops into excessive arch, compressing the discs and joints in the back of your spine all night. That dull low back ache first thing in the morning, the one that fades after you move around for 20 minutes. That is your spine decompressing from hours of being loaded in a position it was never meant to hold. And then there is breathing. Your full body weight is pressing your chest wall into the mattress. Your diaphragm, the dome-shaped muscle that drives about 70% of your breathing, is trying to push downward against the bed. It cannot move freely, so your breaths get shallower. You still get enough air to survive, obviously, but your breathing efficiency drops all night. Here is the detail that surprises most people. 2 arteries, called your vertebral arteries, run up through small bony tunnels in your neck vertebrae and feed blood to the back of your brain. When your head rotates past about 45 degrees, blood flow through those arteries measurably decreases. Stomach sleepers hold their head well beyond that threshold every single night. You are mildly reducing blood flow to the part of your brain that controls balance, coordination, and vision. Every night, For years, stomach sleeping costs you at every level. Neck, lower back, breathing, and blood flow to the brain. It is the clear last place. But the next position on the ranking is one most people would never suspect: the fetal position. Specifically, the tight version, where your knees are pulled up high and your chin is tucked toward your chest. Most people curl up like this because it feels safe, cozy, but look at what it does mechanically. Your entire spine is held in flexion, rounded forward from your tailbone to your neck. Your hip flexors, the muscles at the front of your hips, are shortened all night in a contracted position. When you stand up in the morning and feel that stiffness in your hips and lower back, that is not aging. That is 8 hours of your muscles being locked short. The problem gets worse higher up. When you curl tightly, your abdominal cavity compresses. Your diaphragm gets pushed upward into your chest cavity. The dome cannot flatten properly when you inhale, which means your lungs cannot fully expand. If you have asthma or any breathing condition, a tight fetal position makes it measurably harder to breathe while you sleep. Your bottom shoulder is taking the hit too. Your full body weight stacks on top of a shoulder joint that is often internally rotated, with the arm pinned underneath you. That sustained compression and rotation is exactly the mechanical profile that causes shoulder impingement, that sharp pain when you try to raise your arm overhead. And here is what catches people off guard. Most people think acid reflux is a back sleeping problem, but a tight fetal position increases the pressure inside your abdominal cavity, and that pressure can push stomach acid upward past your esophageal sphincter, the valve at the top of your stomach. Curling tighter does not protect you from reflux. It can actually make it worse. The key distinction here is tight versus loose. A gently bent side position with your knees slightly forward is a completely different mechanical situation than a full body curl. The degree of curl changes everything. This is a modification problem, not an abandonment problem. So far, we have covered positions that cost your body something significant. The ranking shifts here. We move from positions that cause damage to positions that actually give your body something back. Back sleeping. Ask most people which sleep position is best, and this is the one they pick. And for your spine, they are right. When you lie on your back, your body weight spreads across the largest possible surface area. Your shoulders, your spine, your hips, they all share the load evenly. No single joint is being compressed or twisted. Orthopedic literature calls supine the gold standard for spinal alignment, and there is a reason. It is the only position where your spine can rest in a truly neutral curve with minimal asymmetric loading, no facial compression either. Your skin is not being pressed and creased into a pillow for 8 hours. For pure skeletal mechanics, back sleeping wins. But here is the caveat that keeps it from the top of the ranking: gravity. When you lie face up, your tongue and the soft tissue at the back of your throat slide backward. Your airway narrows. For most healthy people, this is minor. But for anyone with even mild obstructive sleep apnea, supine sleeping roughly doubles the number of times per hour their airway partially or fully collapses. About 50 to 60% of all obstructive sleep apnea cases are classified as positional, meaning they are significantly worse on the back than on the side. Back sleeping also works against you if you have acid reflux. In the supine position, the junction between your esophagus and stomach sits at the same level as the pool of acid in your stomach. There is no gravitational barrier keeping acid from creeping upward. Best spine position, worst airway position. That trade-off is what keeps it from number one. The top spot belongs to left side sleeping, and the reasons have everything to do with the fact that your body is not symmetrical on the inside. Your organs are not centered, they are offset, and left versus right side is not interchangeable. Start with the airway. On your side, your tongue cannot fall straight backward the way it does on your back. The airway stays wider. Apnea events drop significantly compared to supine. That alone is a major advantage, but the real surprise is your stomach. Your stomach is not a simple sac, it curves. The larger part, called the greater curvature, sweeps to the left. When you sleep on your left side, that larger curve faces downward. Gravity pulls acid down into the bottom of the stomach, away from the valve at the top where your esophagus connects. Flip to your right side and the geometry reverses. The acid pool now sits right against that valve. Reflux episodes measurably increase on the right side compared to the left. Same person, same stomach, same acid. The only difference is which side faces down. Then there is your brain. Your brain has its own waste clearance system called the glymphatic system. Think of it as a rinse cycle that flushes out metabolic debris while you sleep, including amyloid beta, the protein linked to Alzheimer's disease. Research out of Stony Brook University found that lateral sleeping on your side enhanced this glymphatic clearance compared to sleeping on your back or stomach. Your brain cleans itself more efficiently when you're on your side. One more detail. Your largest vein, the inferior vena cava, runs along the right side of your spine. It carries blood back to your heart from your entire lower body. When you sleep on your left side, you keep your body weight off that vein. Blood returns to your heart more freely. Sleep on the right, and your body weight compresses it. This is exactly why pregnant women are told to sleep on their left. The trade-off is minor but real. Your left shoulder and hip bear your full body weight all night. Without proper support, that sustained pressure can irritate the shoulder joint or the bursa at your hip. But that brings us to the final piece of this ranking, and it is the one most people overlook entirely: your pillow. The single most common reason people wake up with neck pain is not their sleep position. It is a mismatch between their pillow height and the position they sleep in. Side sleepers need a pillow thick enough to fill the gap between the mattress and their ear. That distance equals the width of their shoulder. Too thin and your head tilts downward all night, compressing the nerves and joints on one side of your neck. Too thick and your head tilts upward, straining the other side. Back sleepers need the opposite, a thinner pillow that supports the natural curve of the neck without pushing the head forward into flexion. Add a pillow or bolster under your knees in this position, and you take pressure off the lower back by reducing the lumbar arch. Side sleepers benefit from a pillow between the knees too. It keeps the top leg from pulling your pelvis forward, which loads the sacroiliac joint and the iliotibial band along the outside of your thigh. That hip pain or outer knee tightness you feel in the morning might not be a joint problem at all. It might be a missing pillow. Every 18 to 24 months, the foam or fill in your pillow compresses enough that it loses the height profile it started with. The pillow that fit you perfectly 2 years ago may now be a centimeter too thin, and that centimeter matters over 8 hours. Think about what you know now that you did not know 10 minutes ago. You came in thinking sleep position was just a comfort thing, something you picked as a kid and never questioned. Now you know it determines whether your airway stays open or collapses, whether stomach acid sits safely in your stomach or creeps up towards your throat, whether your brain flushes out waste efficiently or lets it accumulate, and whether your spine rests in neutral or gets loaded into positions it was never designed to hold for 8 hours. And you know something most people never consider: left and right are not the same. Your organs are offset. Your stomach curves to the left. Your largest vein runs along the right side of your spine. Your brain's drainage system has a preferred orientation. Your body has an asymmetric architecture, and gravity is always acting on it. The only question is whether you position yourself to work with that architecture or against it. If you sleep on your stomach, a body pillow against your chest can help you transition to your side without feeling exposed. If you sleep on your back and you snore or deal with reflux, try your left side for 2 weeks and see what changes. If you are already a side sleeper, measure the gap between your ear and the mattress and make sure your pillow fills it. Not thicker, not thinner. That distance. These are not changes that take weeks to feel. You can do every single one of them tonight. You spend a third of your life asleep. That is roughly 25 years. 25 years of gravity pressing on your organs, shaping your airway, loading your spine. You cannot turn gravity off. But now you know exactly what it is doing to each system, and you know how to make it work for you instead of against you.